I'm Dr. Jagadeesh P.C., a senior consultant orthopedic surgeon practicing orthopedics, general orthopedics and trauma, arthroscopy and replacements, which includes the knee replacement, shoulder replacement as well as the hip replacement, and specialized in arthroscopy and sports medicine. After the surgery, the rehabilitation is very important. In fact, we tell to every patient that they have to cooperate in a rehabilitation for a successful surgery. And the rehabilitation starts from the day one. When the patient comes out of the surgery, we'll put them on the machine where the knee starts bending. That knee flexions depends upon completely how much they have got it to achieve it completely in the beginning itself, because they will get some analgesics painkiller behind in the spine, so that will reduce the pain after the surgery, and thereby also it helps in moving their knee as much as possible as they can when they are in the hospitalized thing. Supportive thing, we give it the exercises, like some limited exercises they should do it, like thigh muscle strengthening in the front or the back muscles, which is important for walking. And also the physiotherapist, we help in the protocol, help in reducing the knee bending as much as possible. I mean, they have to keep the leg straight, avoiding it bending it too much, in a static position. So initially we see that how painful it is, or how the patient can recap themselves. If the rehabilitation is really good in the beginning, we put them on walking itself in the beginning, at least for 4 to 5 hours of the later after the surgery. Usually we give it aided, like they'll be using a walker, or some people, if the people are little cooperative, we'll give both the elbow crutches. Walker is always the best for the people who are a little bit of aged, so that they can walk very freely without any fear of falling. And once they start walking, they'll get the confidence. And this walking will not be in a few minutes. We'll make them walk at least for 10 to 15 minutes till they get a satisfaction, and they till get about confidence how they are walking, and then they realize about what they were walking previously and they are walking now with the artificial implant in the knee. Definitely they'll get the boost of confidence. And also this is in the beginning when they are hospitalized, and during the end of the stay in the hospital, say around after 4 to 5 days, we will make them to climb the stairs down, because this is most important, because most of the people, they will have a stairs in that home, and this will help them in building a confidence. They can go home without any fear, so they can climb down the stairs, they climb up the stairs, and further, so if they want to have, we can tell them also, we can make them, encourage them how to use a commode, because day-to-day activities, if they are able to manage without any support, and that gives mainly confidence in building up the patient for further days. And this is the first few days when they are in the hospitalized. Next, when they go home, we encourage the physiotherapist to be attentive with this patient, so that the regular day-to-day activities what we have taught in the hospital can be carried out at home. Strengthening exercise of the thigh muscle is one important, and keeping the leg straight and lifting the leg, so build up some of the muscles which is really weak during their pre-operative stages. Apart from that, we help them again, motivate them in bending the knee more and more, so that they can confidently sit in a chair under any bed and all. Apart from walking, and then to reduce the pain, as I already said, we have a cryotherapy, what we call the ice packs, that will be applied around the knee joint, that reduces the swelling as well as the pain. So the patient, after the replacement, with this protocol in the beginning, the first week, in the first 5 days in the hospital, and after that when they go home, so till they get a confidence of walking independently without any support, that takes at least for a period of within 3 weeks, next 3 weeks, that is from 5 days to next 3 weeks. They will be using the aids with the walker for some, when they want to go washroom and all, but gradually they take out this aids and walking independently. To come to that, at least they need 1 month of a completely from the date of surgery. With the strengthening, they should be able to do without any aid, completely they can be able to walk.